Good afternoon. It's Thursday, December 17. I'm Giovanni Dennis with the Midday News. A special welcome if you're watching online at onespotmedia.com. 5 people were shot, 3 fatally, in separate incidents in Farm Clarendon last night. A pregnant woman is among those injured. The incident occurred sometime after 9 o'clock. It's reported that a car with the pregnant woman and the children was shot up. The woman and the driver were injured. Now 2 men were later shot and killed in the community. Now it's understood that the same attackers then went to Alexander Avenue, where they proceeded to shoot and kill a woman. Residents and small business operators in St. Thomas are this afternoon making another plea to the Prime Minister to reconsider the time allotment for the festive period. They feel the low COVID case count in St. Thomas is good reason for the parish to get increased freedom. O'Shane Masters has their story.
Christmas 2020 is still a few days away, but many residents of St. Thomas expect it to be the worst Christmas ever. The reasons for their pessimism include the closure of the parish's 3 most popular bathing rivers, as well as slow sales in the markets.
We have to follow the direction of the Prime Minister or the persons who are in authority in order to control this COVID. So yes, I understand, and yes, we are not happy, but it's always a but.
Some persons feel parishes should be dealt with on a case-by-case basis instead of a blanket curfew imposed over the festive season. They reason that St. Thomas deserves extra freedom, especially after their efforts in containing the COVID-19 outbreak in the parish months ago. The effort even got special praise from the Health Minister.
Yes, Mr. Andrew, I'm asking you to go with the Grand Market in St. Thomas for St. Thomas now have no COVID. Please, we are looking for that.
For Grand Market, the time is really short. I believe the Prime Minister can give us at least till 1 o'clock, because the crowd of the day doesn't make a difference with the crowd of the night. You understand? We want to sell the food. That's how we make food we live in.
But in case those appeals do not get a favorable response from the authorities, the residents are looking at the possible benefits of the partial lockdown come January.
I really feel that way, so we're not going to get the good time, but we still have to work with the system, because we have to take in consideration the coronavirus. And we don't want it to spread, because we want the people them can go to school January and all of them thing there. But guess what? I feel so then should I give a little time I could go and sell out. That's when Grand Market come, we don't have no whole heap of load.
O'Shane Masters, TVJ News.
The Pan American Health Organization says additional agreements are being negotiated with 2 coronavirus vaccine manufacturers. This for inclusion in the World Health Organization's COVID-19 Vaccine Global Access Facility. More in this report.
Speaking during PAHO's COVID-19 digital briefing yesterday, Dr. Jarbas Barbosa said those agreements, when concluded, will bring the number to 4 following those reached with manufacturers Pfizer and Moderna, which resulted from 2 initial invitations for entities to submit bids for the provision of vaccines.
Our goal, our expectation is to have through COVAX 2 billion vaccines for 2021, but for the first half of the year, we're expecting 65 million doses. So we are going to have the final information on December 23rd when we close up the 3rd period the third stage of the bidding process. We are going to have the bidding, we are going to have the prices, the numbers, and the timeline. I think that some producers already have this agreement with COVAX and others are negotiating it.
Dr. Barbosa explained that for PAHO, it is not about which country the vaccine is from, but rather the efficacy. So far, the Moderna and Pfizer vaccine have effective rates of 94 and 95% respectively.
So for us, the nationality of the import of the vaccine is not important, rather the quality is. So the vaccines will be offered at higher numbers through this facility and also to reach protection for the most vulnerable groups. So for COVAX, we do need that pre-authorization. So far, no vaccine that has that pre-authorization.
Dr. Barbosa says a date when the vaccine will become available for countries under COVAX has not yet been identified due to the low number of vaccines that are available for distribution. O'Shane Masters, TVJ News.
Health authorities are being urged to have a frank conversation with Jamaicans about the COVID-19 vaccine, including possible side effects amid deep-rooted skepticism. President of the Medical Association of Jamaica, Dr. Andrew Manning, notes that persons might be apprehensive about taking the vaccine when it becomes available. However, he says, Jamaicans must be made to understand the importance of taking it.
With any treatment or intervention in medicine, you have to weigh the risk of getting that thing versus the risk of not getting it. COVID is here. It's a real thing. It has killed persons. It has killed doctors. It has killed persons who are older and have comorbid conditions. For us to get past this pandemic and this tribulation as a country, we need to take the vaccine. Now, the powers that be, the authorities, clearly are going to have to educate the population about the vaccines that we get. We have to have a frank discussion about the side effects that have been reported.
In the meantime, Chair of the University of the West Indies COVID-19 Task Force, Professor Clive Landis, says vaccines are among the safest medical interventions. He says they are subject to even more rigorous scrutiny than other medications.
Vaccines are unusual medications because they're given to healthy people, to people who are not sick. Because of that, the health and safety regimes of vaccines are probably more stringent than any other medication.
The opposition is raising concerns about what it calls the low number of people expected to receive the COVID-19 vaccine in the coming months. Health Minister Dr. Christopher Tufton recently revealed that only about 16% of the population is expected to be vaccinated against COVID-19 by the end of 2021. Speaking in Parliament this week, opposition leader Mark Golding said that target is inadequate.
Because that suggests that 84% of the population will not be immunized during the whole of the coming year. And that really suggests that we're going to have to live in the way we are now living, with wearing masks and restricting gatherings and all the rest of it for a very long time to come. And I'm going to ask, why would we not want a more ambitious approach to immunization of the population? And I know it's expensive, but
my response to this question, Leader of the Opposition, is that what was presented would be the conservative case, but I'm certain that the Minister of Health and the Minister of Health in particular would be seeking to exploit all the opportunities that would present themselves to allow us to have a much more rapid vaccination and a more wide-scale vaccination of the population.
And it's now time for a break here on the Midday News, but please stay with us. We'll have much more when you return. Welcome back, and we're continuing the news. 279 people have now died from COVID-19 in Jamaica after 3 deaths were confirmed yesterday. The deceased are a 48-year-old woman from Westmoreland, a 77-year-old man who lived in St. Anne, and a 73-year-old St. Mary man. Now, cases of the respiratory illness have also risen to 11,968. 61 new cases were recorded yesterday. Their ages range from 4 to 90 years old. Worrying news this afternoon for the education sector, in particular early childhood institutions. Fewer than 100 of the over 2,600 early childhood institutions are not prepared to deal with students come January. The concern was expressed by Executive Director of the Early Childhood Commission.
We've been working with all of them since about August of this year. We have 95 that are ready now, and we are encouraging, sponsors to help us get the other schools ready. Early childhood, high-quality early childhood services and programs cannot happen without partnerships. And so we welcome all partners to come on board to assist our early childhood institutions to be ready for face-to-face in January.
And that was the concern being expressed that fewer than 100 early childhood institution schools are ready for reopening come January. The Jamaica Teachers Association, JTA, has reacted to the government's plan to provide every household with internet by 2025. On Tuesday, Energy and Technology Minister Darrell Vaz disclosed that the government will undertake a national broadband initiative which will make access to the internet a public right. JTA President Jasford Gabriel is applauding the initiative.
The easy, less cumbersome route out of this is just to call continuously for face-to-face as quickly and extensively as possible. This is a given, provided it can be done in a safe way, albeit with less than full enrollment in most instances. Bold and visionary leadership will elevate the dialogue to promoting a full digitization of our education system in the shortest possible time. This is a necessary imperative to rapidly advance learning and remain relevant in the 21st century. Accounting for 100% of all learners simultaneously via synchronous learning must be the way to go.
Now, a task force has been set up to provide technical input and oversight required to drive the implementation of the strategy. Why should Portmore be given parish status? That question dominated Wednesday's first sitting of the Joint Select Committee set up to review the proposal for Portmore to be the 15th parish. Vashon Brown has the details.
The Jamaica Labour Party promised to make Portmore parish in its manifesto released before the September 3 general election. The Joint Select Committee reviewing the proposal met today for the first time. Committee member and the Southern St. Catherine MP Fitzjackson asked what's the point of making Portmore a parish.
When the designation would have been made and the residents of Portmore wake up the next day, they will not see or realize one iota of a difference. What difference does the parish designation for St. Mary makes that does not contribute to its development? I hear this argument about what development will occur to Portmore. What development does a parish designation will accrue that the Portmore city municipality denies?
We are looking at other infrastructural improvements, not just talk about roads. You know, when we mention infrastructure, a lot of people think about just roads and gullies and drains, road network. Now we have to look at the digital infrastructure as well and the opportunities that will come with it.
But committee member Damien Crawford was not satisfied.
Intending to discuss. I am sure that the ICT, etc., many of the other 14 parishes, the current 14, would be happy to have some of those as well in their investment. And I fear that if we should oversell the parish reality, then you might face Spanish Town asking to be considered so it can benefit from the goodies that you have highlighted.
I have not heard of what it will do negatively for the people of Portmore or for the communities of Portmore. And if there's nothing negative to come from it, and the only problem is a perception that one political party could gain political advantage, because that's the only thing I've heard is a problem, is that one party could gain political advantage. So are we so concerned about that we will put aside potential benefits for the people of Portmore? They have wanted this.
Committee Chairman Dr. Andrew Wheatley argued that the question is not just why make Portmore a parish, but why not. He said there will be consultation with Portmore residents on the matter. Vashon Brown, TVJ News.
A new regional pathology lab is to be opened at the Mandeville Regional Hospital in Manchester early next year. Health Minister Dr. Christopher Tufton says the over $80 million facility is expected to also improve the quality of healthcare in the region. The lab is the result of a public-private partnership involving the Southern Regional Health Authority, the Lions Club of Mandeville, and the Chase Fund.
Thanks to their collective effort, which dates back to 2017, we can look forward to an on-site, optimally staffed and equipped full-service lab capable of providing critical pathology services while also meeting standards of accreditation and fulfilling the mandate of the Ministry of Health and Wellness to, among other things, reduce cancer incidence.
In news overseas, another world leader has tested positive for COVID-19. A statement from Elise Pallis said President of France, Emmanuel Macron, tested positive after showing symptoms of the respiratory illness. More from the CNN.
The French President Emmanuel Macron has tested positive for COVID-19 after beginning to display symptoms. That means that as per French regulations, he will now be isolating for the next 7 days. His wife, Brigitte Macron, also isolating, although she doesn't have any symptoms, we're told. As for the many people that Emmanuel Macron met over the last few days, we're starting to get some clarity over what's happening to them. The entire French cabinet, that is all of France's ministers with whom the French president met on Wednesday, are not contact cases, we're told, because social distancing was observed. However, the Portuguese and Spanish prime ministers' offices have confirmed that both leaders will be cancelling certain events over the course of the next few days. Same for the President of the European Council, Charles Michel, that the French president met with on Monday. Although he does not have to isolate because he's not technically a contact case, enough social distancing was respected. He has nonetheless announced that he will be observing a quarantine as a measure of precaution. For the time being, though, very little news on the actual health condition of Emmanuel Macron. We know he had symptoms, and that is why he tested and was found to be positive, although we don't know at this stage the exact state of his health.
In sports, despite missing out on World Cup qualification, Jamaica's esports team is oozing confidence about securing the inaugural Caribbean Championship this weekend. Simon Preston has the details.
After finishing third in the Americas Championship 2 weeks ago, the Dr. Birds will now turn their attention to the Caribbean in search of a piece of silverware to end the calendar year. The Jamaicans will face the Bahamas, St. Lucia, Cuba, Curacao, the Dominican Republic, Suriname, Martinique and Haiti in the 8-team round-robin competition. The video games that will be used in the Caribbean Esports Championship are Street Fighter V, Tekken 7 and League of Legends. Veteran national player Nicholas Chinloy will represent Jamaica in the Street Fighter V video game, and he is pleased with his preparation leading into the championship.
Preparation has been good. We have been running training sessions with a group of players every night to be tournament ready. With enough practice being put in, I'm very confident and I'm looking forward in seeing the results.
Vernon Bourne will represent Jamaica in Tekken 7, and he says he is getting close to his best.
I've been watching over my past match videos, trying to see where I went wrong, try to identify my bad habits and try to stamp them out. I've also been making an effort to play a lot more than I usually do. So that said, I'm a lot more confident that I might actually take it this time. Of course, it's definitely not going to be easy, but I'm definitely going to try my best and try to make Jamaica proud.
Vice President of the Jamaica Esports Initiative, Andrew Johnson, is looking forward to the championship.
Expectations of the team are high right now. We just had a third place finish in Tekken 7 for the IESF Championship qualifiers. And our Street Fighter 5 representative, he represented us last year in the EVO Championships and did very well. And our League of Legends team has been making waves in championships and tournaments that they've been playing so far. So expectations are very high. It won't be a cakewalk though, as we're going up against countries such as the Dominican Republic, Haiti, St. Lucia, countries that have been doing consistently well in international tournaments. So I know it won't be easy, but we've been diligently training and I know that it's going to pay off. A lot has been expected of us, and I know that the team that we currently have will definitely deliver on the day. Hopefully everything goes well, and if that happens, then we're definitely going to have a great showing in the CFA Championships this weekend.
The Caribbean Championship commences on Saturday and ends on Sunday. Simon Preston reporting for TVJ Sports.
And that's the Midday News. I'm Giovanni Dennis. Join us at 7 for Primetime News. On behalf of the news, the sports and the production teams, good afternoon.